Good afternoon, everyone, and welcome to our event, Women in Healthcare Technology and Innovation. My name is Josephine Magnussen, and I am the Senior Research Officer at Future Care Capital. Future Care Capital is a 70-year-old health and social care charity who have Her Majesty the Queen as our royal patron. Our vision is to see everyone in receipt of care to benefit from a functioning, fit-for-purpose health and care system. And we do this by focusing our efforts in three key areas. We work with and influence policymakers through our own research. We work and support health and care practitioners, bringing together our own and others' research in order to create debate. And we also put our money where our mouth is, so to speak, by investing for and partnering for social impact. For our event today, we have an excellent panel of women who have the expertise in talking about this topic. And I'm going to move on to introducing each of them in a short while. After that, we move on to our panel discussion. And during that, I encourage everyone in the audience to put questions to the panel in the Q&A box that you should see on the screen in front of you. And if you have a question for a particular person on the panel, then please address them by name in your questions so I know who to direct them to. Moving on to our speakers that we have with us today. We have, first of all, Mariana Obrist, who is a professor in multisensory interfaces at UCL Department of Computer Science, and also Deputy Director for the UCL Institute of Healthcare Engineering. Her research ambition is to establish touch, taste, and smell as interaction modalities in the human-computer interaction, spanning a range of application scenarios from immersive virtual reality experiences to automotive and health well-being issues. Before joining UCL, Mariana was Professor of Multisensory Experiences at the School of Engineering and Informatics at the University of Sussex, and a Marie Curie Fellow at Newcastle University. She's an inaugural member of the ACM Future of Computing Academy and was selected Young Scientist in 2017 and 2018 to attend the World Economic Forum in the People's Republic of China. She's co-founder of the OWidgets Limited, which is a university spin-out enabling design of novel olfactory experiences. The company's smell delivery technology was exhibited twice at the World Economic Forum in Davos in 2019 and 2020. She's a visiting professor at the Materials Science Research Centre at the Royal College of Art in London and was a visiting professor at the HCI Engineering Group at MIT in the summer of 2019. Jenny Thomas is Programme Director for Digital Health London. She's a startup coach and an expert in Femtech. She set up the globally renowned Digital Health London Accelerator in 2016 and grew it from startup itself to the organisation that it is today. Jenny is an experienced NHS manager and has an MSc in healthcare leadership and an MBA from the London Business School. And our final panelist is Lisa Pape. Lisa is an international business leader, founder and CEO of Walk With Path, an organisation that designs and manufactures assistive technology for people with mobility problems. As an entrepreneurial executive, Lisa is experienced in business development, foreign direct investment, life sciences, product and project management, as well as innovation principles and policy. She holds a double master's in innovation design engineering from the Royal College of Art and Imperial College London, and a BSc in human biology from King's College London. So before we move into our proper panel discussion, I am going to give a little bit of background to the event today. So this event is part of a series of events that Future Care Capital are running on health and care technology. We have done other reports and events in the recent past on home care technology and also a review of mental health care technology. And we will soon be presenting research that we are undertaking at the moment relating to learning disabilities technology. But this particular idea for this event came from another report that we were doing that we published earlier in this year, which was looking at enterprise and innovation among clinicians and academics in England. That was not, the focus of that one, not particularly looking at gender, but what we did find was that 80% of companies in the clinician sample and 90% in the academic sample that we looked at, the person with significant control in those companies we looked at were male. And this is a finding that didn't necessarily surprise us, but it nonetheless is quite disappointing in 2021. And it's something that is seen across the board with companies, certainly not unique to health and care innovation and technology. But health and care is a heavily female-dominated area in terms of its frontline staff. And so in that respect, you might expect that more companies in this space would be led by and fronted by women. Furthermore, when we looked at the disciplines within each of our samples, we found that among academics, the most entrepreneurial disciplines were engineering, computer science, and then followed by medicine. And this was companies that were focused in the health and care space, but nonetheless, the most innovation seemed to be happening in these more technology-focused areas rather than coming from the people who were focused on the healthcare areas as such. So that is the background to why we decided to do a specific event looking at women in healthcare technology and innovation. And we are going to have some questions for our panel to talk about the issues in this space. But I'm going to start by asking each one of them to do a brief 2-minute overview on their own experiences as a woman working in this field and why they feel that it is an important topic to discuss. And for that, I will start with Mariana.
Thanks very much, Josephine, for the introduction and really great to be here today. You already gave a very nice introduction. So I would like to actually, everyone who is now attending, just try to think for a second, how do you experience the world? Do you smell your room where you're sitting? Maybe you're sipping on a coffee or some tea. Do you feel the texture of the chair you're sitting on or the floor you're walking? What do you see? This kind of multisensorial experiences or sensation which are surrounding us are ephemeral and they are ubiquitous. And within human-computer interaction or computer science, we often just focus on audiovisual. And my ambition is really to think beyond our eyes and ears and really think about our other senses, because they are extremely important, not just how we experience and interact and engage with the world, but also for our health and our well-being. And I think that's why I think it's very important to think about technologies in that space. And that's really where the research we have done over the last 2 years in my lab at Sussex and now at UCL is trying to really bring multisensory interfaces out from the lab into real world environments. And I was never focused on applications because I thought I'm interested in the basic understanding of what we can do and how we can do it. But it turns out healthcare and well-being is an important topic. And so we're really greatly proud about what we have achieved now with our spin out from the University of Widges to bring digital smell technology maybe a step closer to clinicians and users to improve their thinking about their nose and how it's important for our memories, emotions, and everyday life.
Thank you, Mariana. I'll move on to Jenny for the same question.
Thanks so much, and thanks also for the introduction. Absolutely fascinating also to hear from you, Marianne. Physio for the nose, it's can really see the need for that, particularly now after the past 18 months. So I'm Jenny Thomas, as you've heard. I run an organisation called Digital Health London, but I'm also a startup coach and have a particular interest in Femtech, and I'll explain a bit more about that later. But I guess important to make the point that Femtech is using digital health to improve women's health. And interestingly, about 80% of Femtech founders are women, which is why it's particularly relevant for the topic today. So just to tell you a little bit more about Digital Health London, our first programme was our accelerator, where we help health tech startups. But really what we do is we connect health tech startups with NHS staff and academia, and we equip them to improve healthcare in London. And in order to do that, we have a number of programs, one of which is our accelerator program. But we also have another program called the Launchpad, where we support earlier stage businesses to launch new products into the NHS. We have a Pioneer Fellowship where we support NHS staff to get digital through an education program, peer support, mentoring, etc., to deliver digital transformation projects and to adopt digital innovations as well. And we do a lot of work in evidence generation, bringing together startups and academia too. But the reason why I think this topic is really important, I think I pick up on 3 points. One, because the fact that we need diversity in health tech companies, because where you have diversity, whether that be women leading health tech companies or really making sure that health tech companies are led by the people that they serve, then you're going to get better products. And I think there's been quite a lot in the press recently about the importance of that. So I think it's essential that we have great diversity in our health tech entrepreneurs and leaders. The second thing is that healthcare for women, I think, is a really underserved area of healthcare and would greatly benefit from innovation. And when you're a patient yourself experiencing healthcare, you really know what you need. And I think for me, my background is in NHS management. I was a long time ago a general manager for women's services in a London teaching hospital, and I thought I knew quite a lot about women's health, including maternity, which was a big part of the service. But it actually took me to become pregnant myself twice to go through becoming a mum, and I learned a huge amount about more about what the services we needed to provide only by being a patient, and that's going to be the case across the board. So I think women's health is underserved, and if we get more women into health tech entrepreneurship, then actually that area of healthcare will be improved as well. I also think by getting more women into entrepreneurship, there'll be a real economic benefit as well. Bringing in more talent means that we'll be creating more jobs for people and really developing the health tech industry, which in a Brexit world, I think is a really great thing to do. So there are 3 reasons why I think this is an important topic.
Thank you, Jenny. And finally, Lisa, the same question to you.
Yes, hello, and thank you for the great introduction, Josephine. In terms of my background, as you mentioned, I have a background in innovation design engineering, and therefore the focus for my startup has very much been centered around the user and the user playing a large role throughout the journey. So our focus is on digital health and active wearables to improve mobility, for instance, and our focus primarily is on diabetes. In that, we're looking to improve the daily life of individuals with diabetes throughout the journey, really. We're looking at balance improvement, and we're looking at utilizing data to track movements and also improve health outcomes in the sense of preventing certain risks of comorbidities like ulcers and falls in that population. And in terms of women entrepreneurship, obviously, as a woman, it's very hard, in fact, to sort of compare how my startup would perform if I was a man. And it's something I've often thought about. Do I create some sort of fake persona that actually I can test this out on? But it is something that's really hard to compare, right? So that is the difficulty, I think, in this topic in a way. But it's a really key challenge to address, of course. And at the moment, I'm part of the Women in Innovation program in Innovate UK, where they're also highlighting, again, why this topic is critical to challenge. I think some of the aspects that Jenny mentioned around diversity are absolutely critical. And I think so because the audiences that we're addressing are diverse. And unless we're diverse in our teams, it's very hard to know how to address these audiences and create solutions that people are going to want to use. So that's a key focus for us as well, is how do we create behavior change, which is something that's inherently very difficult. And I think understanding the end user is key to that. And if everything is led by men, we're missing half of the audience at least. And that for me is a real challenge and a real opportunity as well that I think we need to grab.
Thank you. Very well articulated from all of you there. I'm going to start with a sort of discussion generally with a quite broad question. You're all here in different roles and different capacities, but you're all to some extent also entrepreneurs. So I just wonder, generally, what do you think are the challenges of being a female entrepreneur working in thinking about technology and innovation in particular in 2021? What are your experiences there? And I think I'll go to Jenny first for that.
Well, thank you. I'm particularly interested in Lisa's answer to this one, but I guess what I would say, so a while ago, before I established the accelerator, I did dabble myself in entrepreneurship when I was finishing up my MBA. I did something called the London Business School Entrepreneur Summer School, which was a fantastic experience, and briefly set up a Femtech company, so a digital health company, which provided services to first-time mums. And I guess I learned quite a lot there about what some of the challenges might be. And a lot of them were kind of logistic things, I would say. So I was thinking at the time, well, you know, I'm about to get married. I probably want to have a baby at some point. And I was thinking, you know, how's that going to work? How am I going to be able to, you know, run a business and kind of keep all of that going? What about maternity leave and all this kind of stuff? So I think, I mean, that's the case for women in any industry, right? That those things go through your mind. But actually, when you're an entrepreneur, you have to have a certain risk profile, and you have to, you know, you have to kind of take on a lot of personal financial risk. And I think I've got so much respect for the entrepreneurs that I work with, because, you know, they don't necessarily know where their paycheck's coming from, how they've got a team, how they're going to pay them, and you know, it affects your whole life, whether you can afford to buy a house, you know, everything. And so I think as a woman, you have quite a lot of considerations around, well, how's this all going to work around my family, or if you're at that point in your life. So I think that is definitely one consideration. And I think it is fair to say that women and men are, you know, not always, but often different, and still can be within those sort of more kind of stereotypical roles. I think the other thing that we know just through research is that women are less successful at raising money. So about 2%, I think there's a figure from PitchBook in 2021 that said about 2% of all the money available from VCs goes to women. There are lots of different reasons for that, but perhaps some of the reasons are linked to some of the things I've just said. You know, how is this a business, when a VC thinks about whether to invest, is this a business that's going to be moderately successful, or is it going to be really successful? Is it going to really scale? And how committed are the founders, and how able are they? Because that's what VCs invest in. I think from everything I've seen over the last 5 years working with entrepreneurs, is all about the team. And then maybe it's also about the type of business. So the type of problem that the business is solving. You know, if more women entrepreneurs are in areas like women's health, in health tech, that is, then that, you know, maybe those areas are less well understood, because the greater proportion of VCs are men, and health tech entrepreneurs say that makes a huge difference, your ability to be successful, about the investment that you're able to secure. So I think they're some of the challenges and the barriers. But I think what's exciting is that there are a lot of solutions, and it's about you know, how we draw on the findings, say from Future Care Capital report and others, to actually put those in motion. And it's about, you know, how do you have programs that are focused on female entrepreneurs, or how do programs like ours ensure that we attract female entrepreneurs and support them in the best possible ways. And And equally on the other side, within, say, the NHS, is how do you equally encourage women to get interested in innovation and in health tech too? And so supporting women through programs like our Pioneer Fellowship, I think is a good way to do that too. But I'll let the others speak, because I'm sure they've got lots of first-hand experience that's probably more interesting as well. So I'll hand over.
Thanks, Jenny. I don't know, Lisa, do you want to come in there?
Yeah, absolutely. I mean, I certainly recognize this idea of thinking, when do I want to create a family? When is the right time to try and do a startup? Because I knew this is something I wanted to try. So when I started my startup, it was definitely with this thinking that, okay, I'm not going to have a family for a while. So it gives me time to take the risk, right? To only think about myself and not having to care for others. And therefore I can take this financial risk that you mentioned, Jenny. And I do wonder whether men in the same position would have started thinking about that, like planning for a family sometime in life. Is that on their mind equally? I'm not sure. Maybe for some, maybe not for others. I would guess that it's more likely to be in the minds of women, perhaps. So I think that's a key consideration. But I know female entrepreneurs as well who have families and had them before they started a startup, and they've been very successful in creating something and in moving it forward. I think there can be a difficult period perhaps when you have small kids, where you might not be at the right place to start a startup, at least. For me, I actually had a child 9 months ago almost now. And so I'm sort of having to adjust. And I think there can be pros and cons. You learn to use your time better. I think you also learn to know when to say no to things more, because you have less time. So that's a key thing. And that's something that I think actually the child helps you improve, because you have less time available. But I think the key thing and the key challenge and opportunity as well is for the gender balance to be better in that aspect. Why is it the woman entrepreneur that gets questioned on children? And I've heard this again and again. Why isn't it everyone? Being an entrepreneur should not be a barrier to having a family, right? So we need to recognize that that's in the minds of many people, and it needs to be recognized that that's okay, and that it's a common project. It's not the woman's project. It's the family's project and the family's responsibility. I think for me, that's the key thing. A lot of people don't see it necessarily like that, perhaps.
Thank you, Lisa. And Mariana?
I guess I bring maybe a different perspective, because I cannot comment on your experiences, but I think that they are really valuable, and I can see how there are challenges, but also opportunities to become more efficient. At least that's what I heard from academic colleagues who go through the same route of promotion, and then they have their children, and how they do more within less time because you're becoming more efficient. But I think what I wanted to kind of share from my own experience, and I mean, I'm a co-founder, but I'm not the front face of our company. That's my postdoc, Emanuela, and we are a female startup in a way. But I think the key challenges on the way were maybe less related to the gender as such, but more about how do you get from academia into a commercial proposition, the kind of right support. And I mean, we are researchers, we are academics, and I think if I go back to look at our first pitch deck to investors, I can understand why they said no, because it's just a very different language and how to communicate, how to present yourself. But I think what made a real difference was when we had our own funding. So I mean, we were lucky to get through my research funding from the European Union. I could apply for a proof of concept, which gave us an 18 months kind of buffer to really kind of naturally grow our idea and stick to what we wanted and we are passionate about, so that we don't need to pivot somewhere we were not willing to go, because we have a big dream, but we kind of like wanted to make very small steps towards it. And then basically after that, we were lucky again, because my postdoc got the enterprise fellowship from the Royal Academy of Engineering, and that was really making the difference, because she got assigned mentors, and one of the mentors is now our chairman, and he is fantastic. I mean, he just like opened up the world to the business and being a startup, with a way where we could stay who we are and really kind of pursue our ambitions, but also learn a lot. So I feel a big challenge, and I'm not sure if that's really unique to female entrepreneurs or if that's generic, to really find the right mentors to help build this network, but also believing in your ideas without trying to change you. Because I don't know if Danny and Lisa have the experience that investors try to turn you in a certain directions, or other people try to turn you, but and if you don't follow, then they're suddenly not interested. But I mean, if you believe in it, I think anything is possible. But maybe that's my kind of like naive assumption before really entering into the bigger world of business and being more in the background, kind of like providing a safety net for my postdoc who is pushing forward.
Thanks, Mariana. Just to pick up on a point there, what you were saying, and I'm thinking about what Jenny was saying earlier about, oh, I've lost it now. That's not very good.
Well, can I jump in? Because
yeah, please do.
I was thinking about what you were saying, Mariana, and the point you made about you weren't sure whether it was related to being female or not, but going from academia into running a business. And I would say that actually that is it's very common. Whatever gender you are, actually, it's really hard going from making that transition, but it's incredibly important because it's not about a product, it's about a business. And when you're very passionate about solving a problem, you need to make it a business, because otherwise you're not going to get the impacts that you want. And so certainly, it's really interesting at the moment. We've just received a closed up for our 6th cohort of the accelerator. And last night I was going through just doing some initial kind of due diligence for our applications. And I looked through 30 quite quickly. And what actually matters is how well someone can describe, or as you said, pitch what they actually do. So I think one of the things that I would like to see female founders being supported with, particularly those with your background, Mariana, is that actually you can have a great idea, but unless you can explain it as if you would explain it to your grandmother, then that you're going to fall down at the first hurdle. And I'm sure Lisa's experiences too, that actually there's some quite simple things. So you can do all the complex tech, you can kind of, do amazing work in terms of coming up with these solutions. But unless you can communicate it and you can know who your customers are, then actually you're not going to get anywhere. And so that, I think, is a really important form of support to female founders and to all founders. But, this session is about female founders.
Yeah, if I may add something here, it's, in a way, I have a very interesting experience, because I have this kind of bird eye or second person perspective, because I have Emanuela front end and she is getting all the training and then she's feeding it back and we processing it, because I think the enterprise fellowship was doing exactly that, trying to what we as academics are used to convey, package it in a very different way. And I think that is something where, we learned a lot. And I also love it to just be in the backseat of board meetings or investor meetings, just how they're asking the questions. And I think in a way we got quite lucky. Our first investors, angel investors, they take a lot of time to go with us through that through that deck and asking us the hard question, but in a way they really believe in us and giving us a lot of amazing advice. I mean, we just had a meeting last week, and it's like you go out there, it's like I would have never thought of that. I mean, this is just not academia. But I mean, at the same time, we see lots of universities now, and UCL is really doing a great job in having an innovation enterprise unit. We have strategic alliance teams. So they are providing students and staff a lot of resources and opportunities to really take the research and move it to the next level to make an impact. And there I fully agree. It's the impact on the individuals' lives we want to make. I mean, it's the research we are fascinated by, but if we can really bring our smell technology into people's homes so they can do their physiotherapy and train their sense of smell, and it actually increases their quality of life, I think that would be the best kind of reward you could get. And I think that's I don't want to go further, but there are so many anecdotes and stories which really show that you need to work hard to get there, but it is worth the effort.
Thank you. I remembered, I picked back up my thread there that I remember I was going to ask Jenny, because you were touching on earlier about how potentially when you're pitching an idea and it's about Femtech, for example, that it might be less interesting. And that's why I was wondering what Mariana said about how to pitch and who is interested and investors losing interest. Do you think that there is a sense for Femtech or for healthcare technology that is geared towards women's health to be seen as less impactful, or not necessarily less important, but not having as much return, as great return as other technology might in this space?
I think that it's changing a lot now. I think there is like the Femtech market, or kind of like VCs thinking and getting into it, that has changed a lot. If you went back a few years ago, then there'd be some, there are stories of entrepreneurs being asked some quite shocking questions, which would probably just make everyone laugh if I repeated them now. But I think it's different. I think the challenge really just comes down to what I was saying. We all experience this where you think you understand something. So I thought, I had a pretty good grasp of women's health when I was a general manager in the NHS, but you actually have to experience it as a patient to really know what matters. And so, it's a bit like us understanding aspects of men's health, unless we've got a partner who we've lived it through with them, then actually we're not going to understand it as well. And I think it's as much about the makeup of VCs as it is about the ability of women to communicate what they're doing. So I think it's about finding the right VCs. And now there are increasingly VCs in funds that specialize in Femtech. And there are lots of organizations out there, like Femtech Insider, for example, that I work with, that really showcase who these investors are. So I think it's about kind of finding the right people in the ecosystem to connect with.
Thanks, Jenny. Thinking about what you were saying about experience something as a patient, and that is kind of what gives you the insight into something, or a real understanding in that sense. Like I mentioned earlier, the majority of frontline staff in health and care are female, and yet we don't see them necessarily as involved in innovation and entrepreneurship in this space. I'm just wondering, without necessarily aiming to turn all health and care staff into entrepreneurs or innovators, how can we involve them more in innovation as company owners or as innovators? And I think I put that to Lisa first.
In the case of my startup, we do work with a lot of clinicians in the fields that we're interested in, like neurology and diabetes and so on. A lot of them are women and a lot of them are men. It is quite varied, to be honest. I don't necessarily see the clinicians spinning out a lot of companies all the time, but there are NHS programs as well and accelerators for clinicians. So there is opportunity provided in that sense. I don't know either if the clinician is going to be the front person in every startup potentially, but I think the clinician is a great person to join startups and be, you know, the clinical specialist in a startup. I think that would make a lot of sense. But I have seen companies founded by clinicians as well. For instance, I know a female founder who was a nurse and then saw a problem in the real life in the department she was working in and decided to start a company. And then her transition from being a clinician into understanding how to raise investment and all of that, like what Mariana was touching on too, was provided a lot through acceleration programs. So I do think that those are fantastic, especially in the early stages of getting into grasp with all the terminology being used, etc., how to do a contract and all of those things, as well as access to mentors and potential angel investors and so on, like the others mentioned, who can help you along the journey. Which brings me to the point that I think has been mentioned already. Mentors are incredible, I think, for helping you along the way, both female and male. I had somebody actually ask me this morning, a man, a founder, asked me, how do I deal with becoming a father next year? And how do I take that into account when I'm, you know, continuing my startup business? And he wanted advice from that point of view. And for me, that's great, right? That means we have everyone sort of thinking along those lines.
Great, thank you. And Mariana, in sort of thinking about the way that you're working within the university, do you make an active connection with healthcare frontline staff, and how does that work in your particular circumstances?
Yes, so that's a very good question, and I think it kind of is grounded in what Lisa also said. It's really kind of user-centered. I think you said that in your introduction. It's like this: the user is in the center of the design of new technologies, and so that has been, for me, a fundamental approach which we took since the beginning, and that's also core to human-computer interaction. Although you can obviously focus on the computing or engineering challenges or on the pure user studies, I think the field I'm in, HCI, is always kind of like bringing everything together. And for me, it was always important to understand the role of the user. And so within my new role as Deputy Director for Digital Health at the UCL Institute of Healthcare Engineering, I kind of built on that tradition, which was built by Professor Anne Blandford, to really kind of center around the user and the patient and see it as an individual and not just like as a population. Because I think it's this individual experiences which you need to take the time to understand in order to really build good technology and make great designs. And so that is something which is definitely part of our strategy, but also part of the different projects we are doing. And just to pick one example, so when we kicked off the ACM Future of Computing Academy, we started 2 topics as groups of different academics and also practitioners across the globe. One was on the future of computing and food, and the other one was on data-driven healthcare. And as part of that, which was led by the University of Copenhagen, we organized an event in Copenhagen where we invited nurses and clinicians and technologists, academics, and also patients. So you really take this participatory design approach, and it's kind of like it was very useful to spend a whole day with this very diverse group, and we have heard that word a lot. I think it's the diversity we need, and also the subjective experiences, where I kind of like talked with the nurse and how she was excited about new technologies introduced in the hospital, but at the same time really clearly explaining how the technology is also hindering, she said something like creative problem solving, because not always does a form where you complete the patient's information follow what the patient tells you or what you want to mark down about the patient. So it's this kind of like providing technology, but also allowing for control for the staff in the hospital and accounting for the subjectivity. And I know that's very difficult if you need to quantify things and if you need to account for everything, because when things go wrong, you trace back where it went wrong. But I think that's where we need innovation. That's where we need to combine all the amazing digital technologies with this rich experience we see with the healthcare workers, and not just like in hospitals, but also in other places like care homes, but also ultimately at home. I mean, each of us are very unique. We have our own routines, we have our own practice, and technology needs to account for that. So I don't even remember if I answered your question, but basically, yeah, we need to always remind ourselves that we are working with humans, and that human has specific needs, and we need to kind of ingrain that and bring that basically to the fore. And maybe I say one last word before I pass it to Jenny. Is like we said it in before we went live, that when we started pitching 2 years ago about like how important the sense of smell is, investors looked at us as like, smell? Yeah. And the last 18 months have told us a lot about how important it is, specifically to kind of like when we are eating or just for our mental well-being. If you can't smell suddenly, I mean, you become aware of it, right? And then suddenly your experiences, your everyday life is influenced. We have seen lots of reports and evidence how that affects people's mental health, depression, social isolation, and that is also mostly seen also in females, because there's a strong kind of like sensitivity to smells in females and our emotional life. But yeah, just that's a very specific example which we experienced.
Thank you. For Jenny, same question, but I just wanted to bring in, I don't expect you to speak on behalf of the Academic Health Science Network in any way, but there is, the AHSNs were set up to provide this link between frontline clinicians and academic institutions and innovation, and to bring all of that together. And I just wonder if you think, and I don't know if you know, if there's kind of a bias to go more towards the clinician doctor side of things, whether there is as equal involvement with, say, nursing frontline staff in that respect, and whether that support is there, because that's where we have also a large number of female frontline workers.
Yeah, I think but that's, I guess, an interesting question in terms of where, if you were thinking about kind of where to target support, if you were thinking about the question you asked originally, which was how do you involve women more, then certainly, you know, maybe you would think, okay, do we want to focus grants or programs like the clinical entrepreneurship program on particular cohorts of staff, like nurses, perhaps. I think I probably don't have the stats at my kind of fingertips in terms of like how that makeup is, but I would I'd say that there are lots of different ways that those different communities are being brought together, if that's what you mean. Certainly, as I was saying in my introduction, we do a lot to bring together academia and startups, and of course NHS staff too, because often in order to be able to get the evidence, you need to be piloting the technology at the same time. So that's why those three communities are really important to bring together, to be able to get the evidence that companies need and organizations need to be able to kind of purchase solutions as well.
Thanks, Jenny. I wanted to move on to a little bit about how more women can be encouraged in this direction in the sort of early stages. So I'm thinking particularly both already at university level, perhaps, and we know, there is gender imbalances in terms of the types of subjects that are being studied. And in our report, like I said, we found that the most entrepreneurial activity was happening in engineering and computer science in this space, which is probably not surprising. But I'm wondering, is there more that can be done to encourage women both to take up these disciplines in the first place, but also to interact with those, if you're sort of based in a health discipline, for example, but to make the links with the engineering, the more innovative, perhaps, and entrepreneurial disciplines to shepherd those connections. And I guess, Mariana, that's for you as a university professor.
So I think this is a very good question, and still a challenging topic, where I see that lots of universities do actually improve their EDI strategies and really try to encourage a diverse group. And I don't always like to just see the male and female dichotomy, but really open it up to the diverse groups we are seeing, and really encouraging and engaging everyone, whatever background, whatever kind of like gender they assign themselves, to kind of think of their ideas. But I think it's mostly about triggering their curiosity and inspiring their creative thinking, that they actually can do something which goes beyond just like doing a small group project, and really kind of like exposing themselves to the real world. And I see that very much integrated also in new programs. So we just also finalized all the setup for a new master program, which is starting next year, where we have a whole bunch of things around like how we really engage a diverse student group from different disciplines, and engaging them not just in the engineering and computing challenges, but we have a dedicated module on like speculative design and in system thinking, where they have to actually expose themselves to the messiness of real life, because there is a lot of things which real life has you cannot plan for. But how do you account for that? How do you think about those things right from the beginning, and not just as an afterthought? And I think, I mean, I'm only at UCL a bit more than a year now, but I have seen a lot of initiatives where students and staff, especially early career researchers, are invited to kind of like enterprise and innovation events and seminars to even pitch their ideas and do kind of like expose themselves to the questions from not just other academics, but also industry and other kind of associates of the universities. And I think it's this kind of exposure and getting students and staff a bit of a taster of how is it like. Because when I grew up in my academic career, we didn't have that. I mean, we had industry projects, but there was never that you had to kind of like pitch an idea to an investor to get that money. You have the funders as that. But I see more and more that we expose ourselves to really kind of like find the right wording and how that really makes an impact to people's lives. And I think that is something everyone should try and taste. But at the same time, I also think not everyone is made to go that route. And I see a lot in female, my PhD students, master students, and postdocs. Females are often, we are not having that confidence or that kind of, yes, I can completely do it, or this kind of like, I don't know what it is, that kind of immediacy of the boldness, which we, however, we have solid research, so we can do it. And I think we need to tell them over and over again to be bold and try, and I'm basically be behind you. If it goes wrong, it goes wrong. But if you don't try, you will never know. And I think that is something we need to just get into everyone's students, and particularly maybe females' brains. And I think to go one last point, to go a step back, it's not just universities. I think we do lots of outreach activities with schools. And I have given many talks and have given various demonstrations to girls' schools in Brighton, and I will give one in November again, remote for a grammar school in Kent, where we try to really kind of bring together the kind of exciting things and the curiosity around engineering, computing, and couple it with the impact on health and well-being in order to give them an inspiration. You cannot change someone's kind of like passion, but you can definitely fire it up and give them a certain confidence.
Thank you. And so I'm wondering, Lisa, where did you get your confidence to start up your company? Did you ever sort of feel that hesitancy whether you can do it, and what kind of persuaded you to go for it?
Yeah, absolutely. I did very much so, and I still do from time to time. I mean, there's challenges all the way. So you sort of never know if your startup is going to go in the direction you want, and if everything, it's going to go how you like. I think certainly I was perhaps a bit naive when I started my startup. I thought that if I could demonstrate patient benefit, then I would have adoption into healthcare systems. It doesn't quite work like that, I later discovered. So we're working on that generation of much more evidence ongoing. But in terms of the confidence, no, I didn't really have that. I started my startup straight out of my master's program. I did have 7 years work experience between my bachelor's and my master's. So I had been in different industries, in finance and advertising and in business development before going back to university. So I was not like a really young graduate. But the point being, I was studying innovation design engineering at Imperial and the Royal College of Arts. And this was an excellent ecosystem to develop innovations. And also it was really multidisciplinary. So again, like building on diversity. But also the course really facilitated both alumni engagement, and there's a lot of startups that come out of that course. So there was that, and also engagement to large companies. So they opened up the doors to these are the potential career possibilities that other people who did this course have pursued. And that was really, really good. Then it was a bit of a soft landing because I was invited to join the Innovation RCA, which is the accelerator at the Royal College of Art. And of course, I also had links with Imperial, and they also have a lot of support available to startups. So this like initial university-based support is really important because A, you have peers that are in the same boat as you, and B, you have basic things that you can ask people for help on. And these particular academic institutions had a lot of fantastic networks. So they would hold investor evenings, they would do pitch seminars, and I completely agree, getting the messaging right is, the whole thing, really. You can lose somebody's interest very quickly if you don't get it right. Those support programs do help to build the confidence, and they also help you potentially to see your gaps and see what you might need, and where you don't have the skills. You can't do everything as a founder, and that's something that's really important to recognize also, I think. Where do you see yourself? Maybe you don't want to be the front person forever. Maybe you don't have the commercial aptitude. Maybe you don't have this, that, the other. For me, that has been important also to think about. Where do I see myself long term? What are the gaps I have? How can some of my investors help? And the first investors that I got in an angel round in 2016 are still around to help me with things that are their expertise, but not mine. And that's great when you can then build those networks around you of people who also have a vested interest perhaps in what you're doing.
Thank you. So a lot of this, I think, is about, from what both you and Mariana were saying, is about mentoring and role modeling and having those kind of guiding stars there. So I just wonder, Jenny, if you have any sort of final thoughts on that, kind of considering, again, maybe I guess the AHSNs and the roles in that.
Yeah, I mean, I think that's really important, whether that's about creating an innovation culture within the NHS. I think celebrating success of, for example, working with a health tech startup, or really looking at a problem in a different way, whether you're going to use tech as a solution or not. Having role models, people that have done that, and equally on the other side, if you can see that there's, in the context of what we've been discussing here, successful female founders in health tech, then I think it does give people the confidence to think, actually, I can do this too. I can navigate the challenges. I can access grants. I can be successful, securing customers, etc. So and I think that the broader AHSN network do a lot supporting health tech entrepreneurs. They also fund the NHS Innovation Accelerator, which helps health tech entrepreneurs to scale nationally, and they do a lot supporting clinicians too. So the clinical entrepreneurship program for NHS staff that have a business idea, and so I think that there's lots of different support out there for entrepreneurs. And I guess it's just about whether there can be more, and there can be more for different groups. So we really do get that diversity across the board, whether it be for women or for people from different backgrounds, so that we can really make sure that the innovations that are out there are helping everyone, and certainly are not in any way increasing inequalities in healthcare.
Thank you. So I think in terms of, if you're looking at women in innovation and tech and entrepreneurship, whether you see the lack of women there now as a problem or not, I think what we've kind of discussed today is the real opportunities that are there, and that, yes, there are barriers, but we have 3 examples here of the 3 of you who have done very well in a sort of traditionally male-dominated space. And there are the opportunities there for building on that if we just have the right support systems in place and accept that changing gender norms might take a bit longer than we sometimes would like. We don't actually have time for any more questions now. We're coming to the end. So I just want to thank everyone for being part of our panel this afternoon. And I'm looking forward to sort of carrying on these conversations offline after, which I'm sure that we will do. And for everyone who is watching, I just want to say thank you very much for joining us. And please look out for our next event that will be coming on the 20th of October. And until then, thank you so much and have a good evening.